So I'm on the daily newspaper. The daily newspaper is a paper in Botswana, and this was an article that was published on the 3rd of March 2024. And it is an article that speaks to the conversations we intend to have on this channel that are health-based conversations and promoting health-based communication, right? And these are some of the articles that help us to identify what we call the social determinants of health, including factors such as geographical location, your social status, your economic status, your race, your gender, that actually influence your health outcomes. All right. So this is an article that was written, I said, on the 3rd of March, 2024. And the title of the article is Tsohwane launches Leobo la Dingaka. Tsohwane launches Leobo la Dingaka. This is an article that was written in Palape. Palape by the author is Portia Rapitsinyani. Portia Rapitsinyani wrote this article from Palape for the daily newspaper in Botswana. So traditional healers are esteemed individuals within the community, utilizing cultural and holistic methodologies to support the well-being of community members. Their accessibility plays a crucial role as a bridge to enhance the quality of care through community-based practices. Vice President Mr. Slamba Tsohwane expressed the significance of traditional healers during the official launch of the Botswana Traditional Health Practitioners Association, what is also called Leobo la Dingaka, in Palape. The association, registered in July 2020, has garnered attention from various organizations, including the World Health Organization, emphasizing the incorporation of traditional medicine within national health systems with appropriate regulations. Reflecting on the Alma Ata Conference of 1978, Mr. Tsohwane explained how the adoption of primary health care as a strategy by countries like Botswana underscores the importance of recognizing cultural beliefs and values for a successful and dynamic primary healthcare approach. Acknowledging traditional healers as primary points of contact for healthcare seekers, Mr. Tsohwane emphasized their strategic positioning and influence in promoting positive health-seeking behaviors within communities. The government's efforts through the Ministry of Health have furthered the revitalization of PHC, which is the primary health care, to address current global health challenges. The recent COVID-19 pandemic reinforced the significance of community-based approaches in safeguarding public health. Recognizing this, the establishment of the Leobo la Dingaka Association makes a pivotal moment in fortifying a resilient healthcare system deeply rooted in community engagement. Quoting the UNAIDS 2023 report, Mr. Tsohwane highlighted Botswana's successful HIV programs, attributing achievements to collaborative efforts with health facilities. These efforts have led to remarkable milestones, such as the 95-95 achievements, positioning Botswana as a model for evidence-based policies and effective responses in combating HIV and AIDS. While progress has been made, global challenges persist, as highlighted by UNAIDS reports, a life lost to AIDS every minute in 2022, and significant gaps in access to treatment, especially among children living with HIV. Collective action and continued collaborations are essential to address the challenges on a broader scale. Mr. Tsohwane additionally emphasized that in Botswana context, Leobo la Dingaka could play a significant role in tackling non-communicable diseases, often known as lifestyle diseases. He mentioned that faith leaders could have a positive impact by encouraging healthy eating habits and physical activities. Mr. Tsohwane highlighted this word is going to knock me out. antimicrobial resistance, AMR, as another emerging pandemic, underscoring the importance of involving the faith sector in addressing this issue. AMR, or antimicrobial resistance, results in over 1.3 million deaths and contributes to another 3.7 million deaths globally. He noted that many people die from AMR than from HIV and AIDS, malaria, or any single form of cancer besides lung cancer. Mr. Tsuhwane observed a growing global interest in traditional medicine and acknowledged that numerous herbs traditionally used in African medicine have influenced contemporary drug research. This led to partnerships between Botswana faith-based organization network on HIV and AIDS, Bufa Boneta, Leobo Dingaka, and research excellers to establish a center of excellence for traditional medicine research in Botswana. This initiative, he said, was pivotal in promoting good health-seeking behavior. For his part, Mr. Malema, chairperson of the Botswana Traditional Practitioners Association, recognized the government's support and highlighted the purpose of launching traditional healers into the public eye to enhance the collaboration with modern medical practices. During the launch, the United States ambassador to Botswana, Mr. Howard Van Vraken, emphasized the enduring partnership with traditional healers since the onset of the HIV pandemic, underscoring their significant influence and contributions to public health. This was an article that was published on the 3rd of March this year, 2024, and I'm only reading it now since I have only recently started this channel, and I think this is a very relevant article in context to the conversations that we will be having on this channel, showing how various players play a role in public health initiatives and responses, right? I think this is a very good example of the kind of different approaches that are used in health responses around the world, approaches that are informed specifically by the communities in which these, what do we call them, in which these strategies, these collaborative strategies are needed. I think it's interesting because traditional healers have always been a part of our community, and it would be unjust to leave them out of the national, global, or regional responses to public health outbreaks, right? And so I think it is very commendable for Botswana to continue to pull everybody together, making sure that nobody is left behind, as the slogan goes. What else can I see that is health related? All right, I think that's about it from Botswana side, and I will continue to explore articles that are speaking to these collaborations with traditional healers in the public health response. This makes absolute sense if you ask me. Right, my friend, that was the end of that story, and I will continue to seek more health-based news from around the world so we can continue to enlighten ourselves and to create awareness around issues of public health as it relates to communication, right? Alrighty, bye.